Today, we talk about
On my YouTube channels, patients of mine comment, doctor, 1 minute, 10 seconds, you got gyno. When are you going to do it? With a big smile face. And I says, I know, and I'm going to have it done.
Right.
I wake up every morning and I'm trying to make these people great. And listen, I'm 63 and I got gyno. And you know something? Damn it, it bothers me every fucking day, and I'm going to have it done.
Well, I know someone really good.
No, I know two. There would be two people that I would go to.
So it's interesting, and I didn't know if you want to talk about it, but we had spoken about this, where interestingly enough, I know a lot of surgeons, plastic surgeons, you go to their office, and it's like, wait a minute, like, you're telling me that I got to get this fixed over here, and you look like...
Right.
It's like, what's going on? But you actually, you're someone that you practice what you preach. You also feel like you as you've gotten older, you wanted to do something.
Right. I try to eat right. I exercise. If you go on my Instagram, I do, hot yoga all the time. I mean, damn, I just had a hamburger next door, which is probably the first hamburger I had in 6 months.
But look, you're probably in great shape for your age, but you're not 20. And
I'm not 20.
And when you were 20, you probably didn't have an issue at all.
I didn't have an issue, or it didn't bother me back in the in the 70s.
Do you feel like seeing all the cases that you've seen, has that made you think about it more than?
Yeah, no,
really?
I want to definitely have it done.
Right, because I'd imagine just doing it to so many people through like day in and day out, you're probably like you maybe think that even if you had like a 1% issue, that it's something where you want to just get it done. It's like almost like giving someone like people the sickest haircut every day, but your hair is just growing out.
I mean, listen. The bottom line is you want to look good, you want to feel good, you want to look good. Now, some people don't. Some people,
some just don't care. Yeah.
They don't care, and they're happy internal. And it's great if they really don't care.
Right.
They're and it doesn't bother them. Well, God bless them. It's great. But then there's guys. I'm included, one of them. I'm brushing my teeth. I look in the mirror and I go, oh, crumb. I got these nipples that are down by my belly button. It's like, it's like, and if it bothers you enough, and it's tormented enough, and you got to pick out your T-shirts. You got to pick out your clothes. I've got a son who went to University of Miami, and it's the U. So they get big ass T-shirt with the tip of the U is at both of my nipples. And I go, oh man,
It's things like that you don't consider until
until I was at the bookstore at the University of Miami, put on a University of Miami T-shirt with the U on it, and I says, I ain't buying this.
Well, how about a bra? With that,
a bro.
Yeah, a bro.
A man's ear.
Yeah, with that.
A Seinfeld.
Well, you put people into that after surgery, right?
Yeah.
But don't they sell those things for like people to like?
Oh yeah. No, listen, I got guys who duct tape. I've got kids who duct tape their nipples. They and they tear off the duct tape, and they get ulcers and they get skin, or they wear a hoodie sweatshirt in freaking Miami, 100 degrees, and they're wearing a hoodie.
I'd imagine for like kids, and what percentage of patients are adolescents that you see?
Well, I mean, with adolescents, you got to get over the parents. The parents need to say, "Yeah, I understand. Yeah, your self-esteem and this and that is bad. Do something about it." But most of the parents, and really, I blame it on the pediatricians who say, "Oh, wait until you're 16, it'll go away." Right. You know something? It doesn't.
And I know
it doesn't anymore.
And I have it, small, but when you're a heavy set kid and it's small, you have fat plus you have the I remember when I was a kid, I was in sleepaway camp. Kids are not nice.
Which camp you go to?
It was a Jewish camp. It was called Raleigh.
Raleigh, I know Raleigh.
So it closed down. It doesn't exist anymore. But I remember, so I take my shirt off, and like adults know to not say things they're not supposed to.
Where's Camp Raleigh?
It's upstate somewhere. I forget
in
at this
New York
point.
Or Pennsylvania?
No, it's actually New York. It was So you go to camp and you're taking your shirt off to go to the swimming pool, and a kid goes up to me and goes, "Hey, look at Jordan's tits."
Yeah, I know.
And and I'm looking down. I'm like, I have tits, and then all you can think about is that. So that when I actually lose weight and get into shape, all I'm thinking about is like, oh shit, like you don't lose that. So because it's such a transformative time in your life, I imagine that. The worst thing for a parent is to see their kid go through something like that.
Kids could be mean. Kids
terrible.
could be mean.
Kids don't have perspective.
If you're naming your kid now, like Jordan, what did they call you when you were younger?
When I was younger,
What did they call you?
They didn't even know I existed. I was such a quiet kid, believe it or not.
What did they call you when you were? Did they have
I got a million nicknames. Go Sadra, Sidra, Sadar, Saji.
Right,
you
right.
name
So
it.
you had an ethnic name,
Sandra.
so it kind of made it easier for you to make fun of. Like with me, I just
Yeah, of course.
looked fat, so it was more of a visual thing, you know.
Yeah, but that's the thing. Kids don't know anything, and
They
then
don't. They look
visual
terrible.
is in their face. Of course, they're going to pick on the visual, the clothes, the shoes.
I was
Right.
called fat ass. I was called fat fuck. I was called.
Yeah.
I mean everything. I wish it wasn't even that clever. They're bad comedians because they
Oh,
just
they're
come in-
bad- right.
because they come and use the word fat. I mean, like I could do that, you know. They're very hacking their insults.
I mean, but getting into social media now again. I mean,
Yeah.
we always get back to social media.
Yeah.
I mean, everything is kids with selfies and sticks
Right.
and Instagram. I mean, even dogs have Instagram pages now.
Airbrushing, a lot of people don't realize, but funny, a friend of mine today, she sent me a few pictures. Like, which one should I put on Instagram? I said, so and so. I said, your photos, you airbrushed them. I'm like, I don't want to embarrass you, but they look very airbrushed. And that's what people have to realize. Like a lot of these photos that you're seeing of people are altered. And we're now looking to that. Like this is beauty, and again, right or wrong, that's all perspective.
Oh, yeah.
But so it's around us all the time.
Even the stardom. You look at TMZ and
Yeah.
what's his name coming out of the nail salon and they look like shit.
Right.
Right.
Well, look at these actors I just showed you.
Exactly.
When you think of these celebrities, you don't think what I just showed you.
Yeah, that's why I'm so happy. No offense, but even if I get it, I'm not gonna come get it done because I'm just happy that
You're
I'm
happy with yourself.
not thinking about it.
Right. It's not even on your radar.
Yeah, and if someone takes a paparazzi picture of me, which won't be for a while, but
Right.
if it were to ever happen, like I'll be like, all right, yeah, I'm in
Well,
flip flops and shorts.
Right.
What are
I
you
mean,
gonna do?
that's really. I mean, exactly. I mean, that's a blessing that
Oh, yeah,
that you can
for
go
sure.
in. But people are not that
Yeah,
way.
unfortunately.
I don't know. I mean, your parents, raised you right and gave you self-esteem, and
Yeah, I think it's just my messed up brain.
yeah,
My parents did not give me any self-esteem.
no. So,
No, my parents are great, but
it's amazing. But kids, external cues.
Yeah.
And this world is tough.
But that's what I was going to ask you about how many, not even adolescents, but people who are either post-pubescent, like right after they reach puberty, and they develop the guy and they'll come to you because that's more around the time that I would feel mentally like I would need to get it done because when you're an adult, like we were saying, it's more about you. Most people who have or are socially normal aren't going to go to you and be like, hey, what's wrong with your face? Or people don't talk
No.
that way, and if they do, they're borderline on the spectrum.
I think it's not the people don't talk to you about if your nose has a hump on it or
Right.
your ears are sticking out,
Right.
or you got
Right, Doc? I know.
or you got or you got hair that's not up to there, But I think it's more body.
Yeah.
If you're fat, if you're short, if you're skinny, if you're this or that, it's a whole package where they kind of focus on.
Right.
Not that you have a big nose or stuff of that. It's that.
It's such a confusing thing because on one hand, taking your not even position, but the way you feel about it, which is like I don't give a shit, like
Right.
what's on my radar kind of thing. But then when sometimes I will see somebody who I'm like, oh, you don't need surgery, and they get something done. I'm like, in my brain, I'm like, they kind of look better,
Yeah.
So and it's conflicting because I have these two conflicting thoughts where you're fine the way you are,
Right.
but then they get it done and like, oh, wow, you look pretty good. So, and in those two things, it's so hard to kind of like, in my brain, work that out, which is like, you are fine the way you are and you're good and why do anything, right? But then once you get it done, where I'm like, oh, but like symmetrically, you kind of look, because I come from a bodybuilding world, and I'm not gonna lie, when someone comes to me, they're like, do I look better like this or that? I always say, listen, the way you feel, like if you feel
Right.
better but if they say, does this look better to you? I'm gonna answer the question. What I think shouldn't matter, but if they're asking what I feel about it, yeah, I think if you had more definition here and you're bigger there, it's confusing because it shouldn't be that way.
It shouldn't be that way.
But we are visual creatures. Like
we are visual creatures.
Yeah, you can't deny
it's
it.
the same way you say, like, I wish I can just talk to a girl who I wasn't very physically attracted to because she's an interesting person and still get something out of it. And I really wish that, like, let's say we all had this shallow hal syndrome, right? Like, we kind of wish we had that. But the reality is, the first thing we notice about a person is visual. That's how we are. We say they're attractive. Let me see if there's anything going on in their brain.
Right.
We don't start with the brain.
I mean, look at the
know.
presidential, elections and stuff. You're going to have a guy that's, a Bernie Sanders. I mean, not saying anything about Bernie. He's just not going to make it. He will not be
You
president.
don't think so?
No, I don't think. Did you think so?
I don't think so.
I don't
yeah,
think so.
I don't, it's funny because
He's tried how many times now?
What's funny is that so many people were so gung ho about him last time, and now you talk to people like, "Fuck, he's gonna ruin everything." I'm like, what happened to people? There's bumper stickers. Like people turned on him. People turn on politicians real fast.
People turn on anything real fast. It's just like whatever, what's in right now.
Right,
It's like,
it's so funny. I love seeing it too because, and this is why I love not being like a political person, and I just kind of like to sit and watch everything just rip itself apart.
well, politics is just like the in topic right now.
I mean,
Right.
people. You know, I'm not going to tell you my political view, but people should
Tell
be
us.
like
I'm kidding.
like Donald Trump. Say, listen, I'm the best. I'm the best. I'm this. I'm the
Right,
bomb.
right, right.
You know something? They should start. And
It's true, right?
You know,
the truth is, you almost wish people had that kind of confidence in a way because, you know, this guy walks around. He probably I would like to use as his gyno. He's probably got serious gyno. He's probably,
right.
got a bit of a belly. You know, this is not a guy that has really been keeping up. I mean, he pounds burgers like nobody's business. But you got to say about this guy, this guy's got a set of fucking balls.
it does.
I wonder if he needs Scrotex.
But yeah, no, it is. It's funny. Like you wish the advice could be to these other people running.
Right.
Would be like if I can do some sort of consulting work for the DNC. Would be this. Would be like, look at what you're running against.
Right, right.
do you know? Like this guy doesn't give a shit. Like
He doesn't give a shit.
Well,
If somebody,
when everyone
he doesn't
else is-
like somebody,
Right.
he'll call him. Oh, the guy couldn't get laid. You know, if you know he
like people who are running now, they're like apologizing for things they said that weren't even so bad.
right.
And I'm like, this. Do you know who you're running against?
Honestly, I learned a lot from it, and this leads into my next question for you, actually. But I learned a lot from this Trump thing. I should say one main thing, and that's if someone comes at you with anything negative or anything, just be like, all right. And then
Yeah,
it
right,
goes away.
yeah,
It's
right.
like, ooh, it's
People
like
forget.
a magic trick.
Right.
Right?
Yeah.
But I wanted to segue that into my question for you. Again, back to social media. Do you deal with a lot of negative comments or negative feedback or anything hateful or anything,
Well,
especially because
no,
you're dealing in such a physical world?
Exactly right. I mean, I had somebody that I did a YouTube video on, and it was heavy, and somebody did a awful comment, like and you know, one thing great about Instagram and YouTube is that I can delete.
Right.
I can block and delete. If somebody's gonna bash me or bash my patient, call him a fat fuck, this
Right,
and that. Well, you know something, fuck you, screw you.
Right.
I can delete you. I don't have a FaceTime page because FaceTime anybody can comment.
Facebook, you mean?
What?
Facebook.
Facebook.
Okay.
Facebook.
Yep.
I don't have a Facebook because people can comment on my wall and I can't take it down.
Oh, really?
No.
Oh, I didn't know that.
Is that right? I can't take if I have a Facebook page.
I hope that's not true. I mean, it might. It's been so long since I've been on
true.
Facebook, to be honest.
You can't delete it.
Oh, maybe if you have a business page, that's true. That might be true.
Maybe it's business page.
Because they're looking at that as like feedback and review and
Yeah, I was
things
gonna
like that.
say I have a slightly different take on it because I'll get not hate comments, but occasionally get these comments where you're like, all right, this guy. So I don't
Something
delete.
there.
I don't believe in. Yeah, right. I don't believe in deleting or blocking because I just feel like it empowers that person. So I feel like just leaving it there, like, hey, thanks for the engagement and the view.
No.
Later.
So somebody's gonna bash my and me. I can take it, but if somebody's gonna bash a patient of mine,
Yeah, I guess that's a little.
who is out
hear
there
that.
and who's gracious enough to show
Right.
the surgery, something. Say something good for him when
Right.
he's trying to do something.
Right. It's like this guy just got a huge surgery. He got something, removed from it. And they're like, oh, he doesn't even look like he lifts. It's like, oh, shut the
Right.
fuck up.
Right.
It's like, and I think that's another thing that's interesting about what you do specifically because a lot of things in the plastic surgery world, when people say, oh, can I get something liposuction? I'm like, well, just lose some body
Yeah.
fat and go work out. I really feel like that's the way to do it 90% of the time. I'm not against plastic surgery, but I think sometimes it's a crutch to actually do work.
Right.
When it comes to what you do specifically, what you specialize in, the gyno, you cannot fucking work that out.
No, you can't.
Like, I can get someone in really good shape. They can be ripped, but that's still going to be there.
Right.
So in this case, it's not like they're lazy. Like, it's the exact opposite. They might put all the work in. Or maybe they're looking to start that journey, but, like,
Right.
it's just one of those rare things where,
But also getting back to those pictures of Denzel
Yeah.
or Jack or Hassel.
or Russell Crowe.
Or Velsa. If you tested their testosterone,
Yeah.
what is it going to be?
Probably low.
300?
Or Bill Parcell. You see this guy?
Yeah.
I mean, he's got,
Yeah.
he
What's
doesn't
their
give a shit. He's just standing
No,
there.
there's a good point. What's their testosterone level going to be?
I mean, you would imagine it's dropped. I mean,
300.
probably
280?
Probably lower than 3 for sure.
Lower than 3.
Because around 4 is about baseline.
No, actually normal is like is like 250 to
Okay.
1250. That's a
right,
big,
big,
but
yeah.
I bet you give some of those guys a little bit of testosterone, a little bit of growth hormone,
Right.
and they'll change their body. Now, is that right to do?
I don't know.
I don't
I don't know
know.
what right is. What's right?
I don't know.
Yeah.
But as our testosterone levels, change, everybody says, "Oh, I got to take Viagra because I can't get up, I can't get it up and stuff." I mean, some of it is internal. Like, sure, it could be physical, it could be mental, but also it could be hormonal.
Right.
Most likely, it's probably hormonal. And am I against? I've been thinking about getting a little testosterone. Done it right by an endocrinologist
Right.
and getting my levels checked.
It seems like a lot of people,
I've been thinking about it, haven't done it.
Yeah, no, but again, there are endos that will prescribe it for people who are low enough, and
Oh, yeah.
especially when they're, and it's amazing how now, after there's been the ban on testosterone because I think of cheating in sports, where pharmaceutical industries are once again saying, oh wait, there might be a function for this that's more than just, God forbid, if you have testicular cancer and you need to make testosterone. And it's like, they're like, well, this has a risk to it, so we're going to ban it. It's like, okay, well, what about Adderall?
Everything in medicine has a risk
Right.
and a benefit.
It just seems that it's more when they ban a substance or they ban a medicine, it seems more about other things than it is about that. And
Always is.
Right.
It always is.
Because listen. First of all, when you get prescribed a pharmaceutical, when a psychiatrist prescribes a medicine, they don't do blood work on you. They
No.
don't do blood work. So that makes no sense. But again, when you do if you're going to an endocrinologist, they're going to have to do a shitload of blood work before they give you anything because
Well, to be fair, a lot of psychiatric medications don't really affect blood work. If they did routinely, I'm sure they would.
oh, is that right? Okay, so you think if you took it, but
I mean, some could do like liver and this and that. You
Yeah, of
just,
course. But it doesn't happen often enough that
Right.
they decided, okay,
Right.
we need to make this a
Right.
routine to test.
so it's not like your red blood cell count's going to go like.
I mean,
like
there's
there's
this-
medications I prescribe that I don't do any blood work, but then there's others where I'm like, all right, hey, you're gonna have to come in every 3 months to get some blood work done.
Right.
So it just
Right.
depends on the.
I mean, there was a news that I saw this, and you go to a doctor's office now, and I don't have it in mind, but on the signage between your age and your date of birth is, what's your birth gender? Okay, I've seen that. What's your birth gender?
That's happening. Yeah.
Yeah. So there's this girl, I think she's in high school and maybe middle school, and she's gendering, he is gendering from female to male.
Okay.
So he's taking, which is right, you have to say he, is taking testosterone. Now he wants to be, which is, I mean, it's cool. I think it's awesome. He wants to be on the boys wrestling team.
Okay.
You've seen it, I think. He wants to
So
be.
he
and,
was
and-
born-
and he's amazing. I mean, he's a great. And they're saying, well, he's on testosterone,
Right.
and he's beating all these boys.
Right. Well, he's on testosterone. Well, it's so
He's-
interesting.
He's transitioning.
Right. It's so funny to me. Like the whole thing is like now, if I were to say, if I was a woman, I want to transition to, if I was a woman, I want to transition to a man. To get testosterone is very easy, right?
Yeah.
But if I'm a bodybuilder who says, yeah, what I want to do is transition to a bodybuilder. Like if I want to look like a freak, they'll be like, no, go fuck yourself.
Yeah.
Yeah, it's just the optics, right?
And again, it's someone can say, well, this person was born with a condition where they feel, and I'm sympathetic to it. But you know what I'm also sympathetic to? I have I'm not saying that it's gender dysphoria or whatever. I'm just saying that what I have might be body dysmorphia. And I said, if I don't feel like I'm 350 pounds jacked, I'm gonna be fucked mentally.
Right.
So give me that fucking testosterone.
No.
It's like so. It's like, at what point do you just say because what's going to end up happening, right? And what does happen with any other of these prescription drugs, or even if they make plastic surgery illegal, people do it anyway, and they're going to do it without a doctor. And when they do it without a doctor, it's 10 times more risky, and you get these infections. And guess where they go when they get sick? To a doctor. Guess where they flood hospitals? I'm sure a lot of hospitals get people who inject things wrongly, and they take things that were made in a bathtub and they get infections. So it's like now you create a problem. People are going to take this shit anyway. Don't you want them to go at least to a doctor? Or like I would love to go to my doctor and say, I take this, and that, just so you know, and here's the blood work I want you to get done. And he can say, listen, I think you're stupid for taking it. I don't condone that shit, but here you go. Instead of him saying, leave my office, I don't want to deal with a guy like you. It's like, okay, well, I'd rather you take the blood work to see that I'm at least doing the unhealthy thing in the healthiest way possible, or at least that I'm not dying. It's like, at least do your job, It's like if I was a smoker, you wouldn't kick me out of the office. I just feel like a lot of times what doctors are doing, they're just being the moral compass for you. And it's like, I don't know. I didn't know that you signed up for that.
Well, and, also you get into that. Doctors are overworked. They're underpaid. Don't think doctors are. It's a whole thing. I mean, I'm in a different area, but you go to a regular pediatrician or an internist, they're only going to spend 15 minutes on you. They're going to, check your lungs. Check your heart, draw blood, do an EKG, stick a finger up your ass and feel your balls. At least with me,
Give you a scrotex.
Right, and it's done. It's over. The exam is over,
Right.
and doctors are they're overworked and
You don't even see a doctor half the time. You
right.
see what is it, the physician's assistant or something, right?
You see,
a
and
nurse.
if you have a headache, they don't send you to a neurologist. Which is true. They get you a CAT scan of the brain, make sure you don't have a brain tumor.
Right.
You have a stomach ache, make sure they do an ultrasound, make sure you don't have gallbladder.
Right.
But the physical exam, it's over. It
Right.
really doesn't do anything anymore.
Right. Well, I want to change gears a little bit.
Yeah,
because there's one